to Dr. Chip's Fix. You're right, it's not a misspelling or mispronunciation of our title. We're making our first evolution into our YouTube channel together to Dr. Chip's Fix, F-I-X. We're still gonna do evidence-based physical therapy exercises and workouts, but we're also gonna be doing other things that I like to do. You know that I was a professional dancer and actor, and even when I was a full-time physical therapist, I would find ways to incorporate music and dance and occasional drama in the job. Music, dance, and art are all proven therapies and have an undeniable place in the world of health and wellness. So think of our channel now as not just a quick fix, but more perhaps like this moment's fix. That's why it's now Dr. Chip's Fix. I hope you continue to tune in and support me in sending you a momentary fix for lack of strength in the moment. Maybe not just muscle strength, but a boost in your momentary drawl or slump. We might dance or jump into a song sometimes just to shake the blues away. Enough talk, let's get started. So when you're first just getting up, I will start with the head and neck and also the just shoulders. Okay, so we just turn our head. Say we got up. Hey, it's morning. Thank God we're alive. Okay, so we're gonna just turn our head side to side. Nothing much, easy. Okay, get the circulation started. Maybe 10 slowly. If you have your partner on this side, say good morning. To the side, to the side. So 10 of those. To the side and to the side. Not fast. I'm just gonna do it a little fast for brevity of this video. Side and to the side, and then upright. We talked about in the last video about posture. So in posture, I like my head not too low. So I use one pillow, not too high, because let's see how it distorts your alignment already with just two pillows. So I want it to be a little flat. Some people who have hard time breathing if their heads are not elevated, so that's fine too. If you don't have breathing problems or sleep apnea, your posture should be like all the way straight. So next would be just arm raises and down. So for my mom's caregiver, Gina, so if you have to help Nanay get up with the arm, so help with the arm, but encourage them to move by themselves. Okay, so if she can move it up by herself, well and good. And if a person can do both at the same time, even better. Okay, all the way back here. Reach your back headrest or headboard. Okay, and down, and up, and down, and up, and down. And again, if you're assisting someone, it's best to be close, holding them close to the shoulder joint and the elbow, both supported, so that this doesn't flap down. And for people who are helping out people who had stroke, then if this is, say, the weak side or the flaccid side, then you have to support the whole arm, so this arm doesn't fall down like this. But to protect the joint and the bone from kind of like hurting it or maybe fracturing it, if it's too spastic, you have to hold the arm close to the joint. So your hand placement will be here, close to the joint, close to the shoulder joint. Okay? And then 10 of those, we'll say 10 of those. And stretch out. 9, 10. And again, I'll speed up some of these a little bit. If you have to pause the video or watch it again, then just do so, okay? And next would be, this is what we call in physical therapy, horizontal abduction and adduction. So, adduction. So I call this so that patients will remember it better. Like, I love myself, and then I give the love. Love myself, give the love. So again, for people who need help, hold the arm, assist them, or encourage them. You say like push. You can say push, push, push against the hand so that they have a little resistance, and then push, push, push against the hand going this way. So you can only do one side at a time if they need assistance. Okay, so going this way, reach all the way as far as they can, or like the hug themselves kind of motion, and then opening up. So same thing. And again, as we've talked about in the past videos, there's always a rhythmic breathing throughout. Okay? So 5 more of these. 5. You can smile, doesn't have to be hard. 4. 3. Love yourself. Reach in. 2. Give yourself a big hug. And 1. Okay. Usually, if there's a diagnosis or older people, they may need a short break in between 2 or 3 sets of exercises. So give them a minute or 2 to 3 minutes of break. The next one is punching the ceiling. Punching the ceiling. Okay? 2, 3. So if they are wanting some entertainment, and then you can play some music with this and remind them about this age, like Muhammad Ali or Manny Pacquiao or whoever are like the boxing icons, or Bruce Lee. Punch right in front of the nose. Punch. And then if they have small weights, they can do this too, but watch out that the weights doesn't fall on their face. Okay, so punch in front and punch like this, and extend the elbows fully, and then down. Okay, and down. It's good for regular people too, just to start the day like this before even getting up. Nothing wrong with that, right? Next is just having your knees bent together, and we call this knee rocks. So you're going side to side. Again, 10 of these, 5 maybe. It's good for stretching this side of the body. Depending on the diagnosis, if there's like a hip problem that was like newly operated, then take care of the precautions. Follow precautions from the surgeon. Okay, so for hip replacement, there will be precautions, like you can't do these things for a few months. Okay, so side to side. And for those people who need help, just guide them a little bit. Guide them like this. Give them a little push. But let them do the movement. Okay, this is coming from my trunk, from my torso, this movement. Let's say that's already 5, 6, 7, 8, 9. If you need to, you're gonna have to rewatch this video or just pause it. If you need to review it, or this is a little too fast for you, then pause it first and then resume when you're done. Resume to the next exercise. Okay? 9, 10. Okay. Then we're gonna go right into the clamshell. Open as wide as you can. Again, if there are hip precautions, like from after hip surgeries, then you have to follow those and not do this exercise. But for most hips, this is good and healthy. So open wide like a frog legs and together. Wide frog legs together. That's 5. Same thing if person needs help. One side might be weaker than the other side, or one is more mobile than the other side, then that's where they're at. If they need a little stretch on one side, I have a patient who's like can only go this much on say one side and then the other side, so I give it a little bit more attention. So I push a little bit here and give it a little stretch, give it a little bit of push, not too much, depending on their tolerance. Ask them if it's okay with them, if it's not painful. If it's just a stretch, a soreness from the stretch, then they can get used to it with practice. Let's say we've done this. This is 8, 9, 10. You give the joints a break, the muscles a break. Shake it off a little bit. I know my mom might need a break like that. Stretch the legs back to straight position and then kind of like wiggle them side to side. Okay? Make them relax for a moment. Okay. And then next thing is one leg bends, and then again, if there's no hip precautions, then it's okay. Or if there's no severe pain, then it's okay to do as much as possible. Get to your maximum hip flexion. And then I also encourage people to grab their knees from the back, because a lot of times for older people there are a lot of knee issues. So grab their knees from the back and also clasp their hands together and do this. This is also good kinesthetic sense for people, like for their connect their mind and their bodies, and also like awareness of their legs. So it's a good exercise, and not only for mobility but also for awareness that, hey, I can do this to my legs. Give them more empowerment of their body control. Okay, so some people might just be able to do something like this, or like slide they would call this a heel slide. Slide their heel as far as it can towards their butt. That's okay too. If that's where they're at, that's where they're at. Be honest about it.
But this is, I'm showing you also like the maximum stretch that they could do. Okay, and then I do this alternating to also mimic the pattern of walking, the reciprocal side of the right and the left. Okay, grab. Some people don't have to grab. Some people like grabbing here. That's fine too. But I find it like with a lot of older folks who have knee issues, then they say, and then there's like less pressure on their knee if they kind of like protect their knees from the back, and then they do this from the back of the thigh and clasp their hands together, like also like a coordination of the hands. So hitting two birds with one stone, right? We taught Jose that concept of that phrase. And he's like, ah. Hitting two birds with one stone, okay? And some for advanced people, they can like kind of like a biking thing. This is what you want to happen with the legs, like they can do this, right? But for some people, they need a little bit of help. But your goal is to be able to do like bam, bam, bam. Okay? Right. Take a breather. Take a deep breath and exhale. Depending on people's baseline, usually we're allowed 20 beats per minute of increase from their baseline heart rate. So if their heart rate started at 80, then if it goes to 100 and they say like, I'm tired, so let them rest. Even though like some families will say like, no, push her. No, I took her heart rate and blood pressure are increasing and it's too much for her heart, so I'm letting her rest. So if you're a caregiver, you can say like, hey, I'm letting her rest, I'm letting him rest. Okay, so we'll do a we call pelvic bridging. Very good exercise for everyone, but it's for the butt muscles that you make a bridge out of your pelvis. You raise it up. It's also used in yoga a lot, and then down. Okay, if they can stay up there a little long, like 3 seconds, good. 5 seconds, that's good. I think my mom is having a hard time doing this. Hi, Nanay. So you have to do this, Nay. Okay, up and down. So their knees together like this, or knees apart. It doesn't matter. It's okay. But the important thing is like they're squeezing their butts together when they get up there, and then really it can get up high. But for older folks, it's probably they might have to start somewhere. They have to start somewhere like low. That's fine, but just monitor it that you're trying to get them higher and higher and higher. And then there's also the beginner version of this. Is just like squeezing their glutes together, squeezing their butt cheeks together. So squeeze them here. At least that's the beginning isometric motion of this exercise. But then next thing is like bridge the pelvis, good for butt muscles, which are used for standing and walking. So very important. And then also the back muscles get activated back here and then down. And then since this is very important strengthening exercise, I might ask Gina there to do this in the first week, in the next weeks, just up to 10, and then we will increase it after maybe 3 weeks of doing this 10 times, along with your other exercises that you do and walking. And up. This is good for you, Tai, too. Everyone. A lot of dancers have this kind of like Pilates, I think, or maybe yoga training, that I see them going like this, and then the advanced part is like they reach the leg up and then go like this. So that's good too. But for older folks and a lot of like bed bound people, because they haven't been moving their bodies and their muscles are tight, when I start them with this, they get a lot of like a Charlie horse feeling here. So you're gonna have to rest it when that happens. Or cramp, a cramp back here in the hamstrings. So they go like, oh, because they haven't been exercising and mobilizing. So it's very tricky sometimes. So you can start them out with some kind of like stretches for the hamstrings, which are like really like this, which is our next exercise. It's like straight leg raising. In straight leg raising, you raise your leg straight at the knee, and then preferably your foot is flexed. I'm showing it to the camera like this. So your foot is flexed so that you're really activating all the quad muscles, and then lowering it down slowly. And don't go too high like a ballerina. It's fine if you're doing a stretch of your hamstring, but also just here up to 45, even just a little higher than the bent knee. This, you use the other leg as the anchor, okay, for your body, so that everything is steady here. And then you go straight leg and come down, straight leg and come down. And then in Pilates too, they use this like the descent or coming down is you use your abdominals to control that. So get up and then get down, get up. Good for knee weakness of knee muscles. If you have, like in the beginning of my rehab, I had a scope of my knee. This was one of my most important exercises. Straight leg up. For some people, they can only raise their legs like this, as much as like this. That's fine, as long as they are activating their quad muscles. Okay. And then notice, if you do this 10 times and if you're not used to it, your leg will start shaking, and that means it's tired. You give it a break, and then for further training, you do another set of 10 and then another set of 10. Maybe if you get up to 4 sets of 10, then you can put an ankle weight or resistance. That means like your legs are really getting stronger, and you will notice it in your walking, in your dancing, in your running, that, hey, that really helped. That really helped me, because this has gotten easy, and you added more leg exercises, and then it translates to your everyday life. Okay, I'm gonna do my other leg. Okay, just 10 of these. Just go with me. 1, a little slow on the descent. Okay, and control it with your core too. 2, 3, 4, 5. Breathe. Smile. 6, 7, 8, 9, and 10. Good. Relax for a little bit. When you're relaxing, you can do up and down with your feet, your ankle pumps. Do those. Okay? While you're just relaxing there, you can do these exercises, the ankle pumps, like what I discussed before in my other video of watching TV. This will save you from blood clots. In a plane, you're in the plane ride, this is your number one exercise in the plane, besides getting up. Okay. Next is just if a person or a patient can go on their side, you need pillow support. You know, the pillow support with your arm, you need the pillow support with your leg. You can bend the bottom leg and then the straight leg here, straight leg to the side, kicking to the side. Okay, you can use your core muscles too, because it's going to start rolling over like this. So up, down, magic. I had my pillows over there. And mind you, this is the best, found out by research that the best exercise for hip abduction, like compared to other exercises, this is the one that recruits the most muscles and better results for activating the hip muscles, the abductors. 9, 10. Okay, figure it out, because I'm gonna turn around there and then do the other side. Okay, ready? 1, 2, 3, 4. Use your core here. 2, 5, 6, 7, 8, 9, 10. That's a little more advanced version of hip abduction, but you can also start with just going like this. 1, 2, 3. So for Nanay, Gina, and Inday, out to the side, and you might have to help her leg out, but try not to turn the leg like this. Okay, that's cheating. So just out, knee up, facing the ceiling. Okay. 10. There shouldn't be a feeling of like getting compressed in the hip joint. It should be freeing, like the hip joint is pulling out of its socket, like reaching down there. Okay, this side. Pull out. Ready, go. 1, 2, 3, 4, 5. Breathe. 6. Smile. You can rest and pause this video if you need to. Drink some water. 8, 9, 10. Relax. The next one is for some people who need more help with getting down. Just the same one that we had before. When you bend, you can resist the foot. This is for Gina and my mom. Nanay, you have to kick your leg against the hand. So kicking it down, and same thing going up. If they can endure or take resistance, resist their going up, and then the coming down, resist the foot by holding their foot and say, kick my hand, Nanay, kick my hand down, all the way down. Okay? So up, and then if you're helping someone, you can only do this one leg at a time. Okay? You can't do both legs at the same time or reciprocal. Maybe you can do 10 on each side and then push, push, push. I tell Nanay, push, 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 all the way down. Okay? Push, 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 all the way down. Okay? Push, 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 all the way down. Same thing. Push, 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 all the way down. Forgot to say this earlier. Push, 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 all the way down. So activates all the other muscles that are just used to having a helper. So this is easy for them because these are big muscles of the butt, the glutes, that can push down, and it translates to their standing and walking. Now we go to rolling. You have them roll, so it's easier to bend this side. If I'm going this way to my left, bend my right side, and then I go reach. You say reach with your right hand and roll over this way. Good for like helping them change their clothing or diaper change, and then same thing going down. So if you want an exercise for like strength of their trunk too, you can have them like resist your body, their body to roll back, and then reaching back. Some people not doing a lot of walking, or as we get older, we're not like running or jumping or swimming, and so our bodies don't get to stretch, so we are contracted a lot of times in the front of our bodies. So because of the sitting position throughout the day, so it's good also to get them to lay on their stomachs. So after getting to make sure that you have the space here and not fall off the bed, and so after rolling into like this, right? So stretch them and then get them to their stomachs if they can. Okay, so they get to stretch the front of their body, and then and then go back down, help them, or on the other side, down. Okay, so again, if I'm going this way, then have that space over there. And for in my mom's case, maybe that I can't be there. So Nanay can roll, and then good exercise too for mobility in the bed, and also just stretching the body. Okay, stretching like tight parts of the body. So I bend this leg so that leg, my left now, I'm rolling to my right, my left now, that knee leads, and my left hand reaches over so I can initiate that movement going to the side. And once they're on their side, they can balance there for a few minutes. This is good position for hygiene, for bedbound people. Also just pressure relief, so they're not always on their backs and then they get bed sores. So this is a good way to mobilize a person, okay, and not get any bed sores, or also mobilize their lungs, like moving. And in COVID times, if I don't know if you guys have heard it, that proning, meaning being on their stomachs, like patients even in the ICU are turned over on their stomachs. So that's done passively with maybe like 5 or 6 I think members of the staff have to do that. So if a person can roll on the stomach, then it's good, because it's good for anyone's breathing, because the lungs don't collapse, and if they're getting pneumonia, then the lungs will tend to collapse and get flattened, and then the more that its air is having a hard time getting into the lungs. So that's why they put them on their stomachs. So this is also a good way, as I've said earlier, to stretch the front of the bodies for people who are in their wheelchairs or their chairs, sitting in computers for hours and hours, and then they get all kinds of back pain and hip pain and whatnot. I think that's all for today. Thanks for joining me again, and see you next time. And then after that, by the way, play some good music to your loved ones, to yourself, and have a dance party and dance, and make sure that that's their favorite music that they can relate. That's their era that they can enjoy. My mom would enjoy maybe the 50s music, or the 40s and 60s, 40s, 50s, 60s. Then enjoy and play along and dance with them and sing with them. Okay, see you again next time. Thank you for joining and watching me. Bye.